Sims. My name is Lainey. I'll be your nurse today. Alright, I'm going to perform hand hygiene. And I'm also going to be putting on gloves for this assessment. Alright, Mr. Sims, can you verify your name and birthday for me? Okay, perfect. I have verified that that is the same on your ID band. Alright, while I'm putting on my gloves, I'm just going to perform a general safety assessment of the room. My patient doesn't have any tubes or drains or catheters, so I'm not concerned about any of them being tangled. I know that my patient's call light is within reach, it's plugged in and it's working, so I have no concerns there. So now I'm just going to explain to my patient what we're going to be doing today. Alright, Mr. Sims, today we are just going to be doing a head-to-toe assessment of your body systems to make sure that everything is in working order. Is that okay with you? Okay, great. So my patient's mood and affect and their quality of how they're acting is good and normal, and I'm going to proceed with my assessment. Alright, so first I am going to obtain a set of vital signs: blood pressure, heart rate, respiration rate, oxygen saturation, and I'm also going to assess their pain level. Alright, so their blood pressure was within normal limits, as well as their heart rate, respiration rate, and oxygen sats. Alright, sir, how would you rate your pain today? Are you experiencing any pain? No, okay, so my patients would rate his pain a 0 because pain is not present. But if he did have pain, I would assess it using Caldera, which is C, characteristics, O, onset, L, location, D, duration, E, exacerbation, R, radiating, R, relief, and A, associated signs and symptoms. But again, my patient rates his pain at a 0, so I am not concerned about that. Upon my initial assessment of my patient, I'm going to make sure that there are no tubes or drains that I need to assess, which my patient has none. But if he did, I would check his catheter site, I would check his IV site, I would make sure that there's no signs of irritation or bleeding or anything abnormal going on with those tubes or needles. And my patient doesn't have those, so I'm going to move on. Alright, sir, so first things first, I'm going to be taking a look at his neurological systems. Okay, so when I move my hand, I'm going to put my hand over your eyes, and I'm going to shine a bright light in your eyes. Will you just be prepared for this light, okay? Alright, sir, perfect. So, now will you follow this light for me? Perfect. Up and down, in, great. So my patient's pupils are perla, and that stands for pupils are equal, round, reactive, and accommodate light. Okay, great. Sir, can you tell me your name? Yeah, he can tell me his name because upon our introduction, he told me his name and his birthday, so I know he knows who he is. Alright, and do you know where you are today? He's in the hospital, that's right. Okay, and do you know what day of the week it is? Great. Do you know who the President of the United States is? Great. Okay, so my patient's LOCs are ×3. He's doing great. His mood and affect is good, and his LOCs are good, as well as his pupils are perla. All right. So next, I am going to move on to the ears, nose, and throat. So I'm just going to take a look at the oral, nasal, and ear cavities. All of them look good. His facial structures look good. Sir, can you smile for me? Okay, great. So my patient's speech is not slurred. His smile is even. He's making eye contact with me. So overall, his neurological system and his ENT systems are all in working order. All right. Next, I'm going to move on to inspect his thoracic region, or his cardiac system. His cardiovascular system. Okay, sir. So upon initial inspection of the chest, it looks even. I don't see any deformities. I'm just going to take a look at the color of your chest. Okay, great. Yeah, so I don't see any discoloration. He doesn't report any pain, but I'm going to ask him one more time. Sir, are you experiencing any chest pain? No, he's not. Okay, so great. I'm just going to take a listen in 5 spots. I'm listening in the aortic region for any abnormalities and just to make sure that the heart rate I recorded earlier corresponds with the normal C now. Okay, now I'm listening to the pulmonic region. Now I'm going to listen to Erb's point. Great, and I'm making sure that I'm listening in a few seconds in each place just to make sure I don't miss anything. Now I'm listening in the tricuspid region. Great. And now the mitral region. And I'm going to hang on for a few seconds here, like 15 seconds, just to make sure that I'm getting the correct PMI, the maximum impulse here that corresponds with his heart rate earlier. Okay, great. So I've assessed his cardiac system, no chest pain, and I listened to all 5 points. Great. So now I'm going to move down lower to the pulmonic system, to the pulmonary system. And that will again be in the thoracic region. So I've already inspected my patient's chest, and it appears to be rising and falling evenly and at a great pace. I assessed his respiratory rate earlier. It was of normal range, and I so far don't have any concerns, but now I'm going to listen to his chest anteriorly to listen to the lungs, each lobe on each side, to make sure that I'm hearing even and equal sounds as well as seeing a regular rise and fall. Oh, and before I forget, sir, are you experiencing a cough right now, or do you have any pain associated with breathing? No? Okay. Are you having any difficulty breathing when you exercise or when you exert yourself? No. Okay. So yeah, I'm going to listen in 6 places on each side on the front, and then I'm going to do the same on the back. So the first place I'm going to listen is about right beneath the collarbone. And then I'm going to move in an orderly way, horizontally, and down to the 3rd place, listening for a few seconds. Okay, on to the 5th, and the 6th. Okay, great. So the sounds were the same and equal on both sides. The chest is rising and falling regular. I don't hear any stridor. I don't hear any difficulty. And my patient doesn't report any difficulty with breathing or any pain associated with that. So now I'm going to keep moving down to the abdominal region. So first, I'm going to ask my patient about his recent bowel habits. So, sir, have you had any significant changes lately in your diet? No. Okay. Have you had any significant changes in your bowel movements? When was your last bowel movement? Okay, yeah, this morning. So things seem to be working well. He hasn't reported any pain, but I'm going to ask. Have you had any pain associated with going to the bathroom? No. Okay, great. I'm really glad to hear that. So before I touch or palpate my patient, I'm going to take a listen. I'm going to listen in 9 regions just to make sure I don't miss anything. And while I'm listening, I'm also going to look out for brewy sounds. Okay, so I'm just listening for normal bowel sounds. Make sure that bowel sounds are present. Okay. And again, I'm moving in an orderly way horizontally, making sure I'm not moving all over. Okay, great. Everything sounded normal. Bowel sounds were present. All right, sir. Now I'm going to lightly touch your abdomen. Is that okay? All right, perfect. 2, 3, 4. And what I'm watching out for as I feel is my patient's response to it. And he didn't seem to be feeling any pain with the light touches I I made, and it doesn't seem to affect him, and he didn't report any abnormalities or pain associated with his abdominal region. So I have no concerns there. And from the skin that I can see, is it okay if I lift up your shirt a little bit? Okay, great. Yeah, so I don't see any discoloration or abnormalities with the abdominal region, and all of the sounds were normal. So I'm going to go ahead and move on to the musculoskeletal region. Alright, so I'm just going to uncover my patient a little bit. And first things first, I'm going to observe the skin for normal coloration, which he does have normal coloration. I'm going to assess for turgor as well. Okay, sir, I'm just going to pinch your chest a little bit. Okay, great. Yeah, so everything looks normal there. And his coloration looks good. He doesn't seem to be abnormally red or pale or anything like that. Alright, so I'm just going to take a closer look. No wounds or cuts or abrasions, but if he did have wounds or cuts, I would definitely assess those and treat them as needed. But my patient doesn't have any, so I'm going to continue with my assessment. Okay, I'm going to check for cap refill. Looks great on both hands, on both sides. Okay, I'm going to do the same on the toes. Oh, great. So circulation is good. Now I'm just going to feel my patient's pulses. All right, they're equal bilaterally. And I'm going to feel here too. Great. Equal bilaterally. That's great. All right, so can you squeeze my fingers? Okay, good. And can you push against my hands? Great. Can you pull your toes up? Great. All right. So everything looked good with my patient's skin and musculoskeletal systems. I have no concerns. His coloration is good. The temperature of his skin is good. The turgor is good. The overall quality of his skin is good. He has no wounds or cuts or abrasions. And like I said, I would check IV sites. I would check any drains that are present. I would check any dressings that are present, but he has none present. Okay. So next I'm going to ask my patient about their genitourinary habits. Okay, sir, have you experienced any pain or difficulty when trying to urinate? No, okay, great. And has that been normal for you? Okay, and the color and quality of your urine has been good? Okay, I'm happy to hear that you don't have any pain associated with that. And my patient doesn't have a catheter, but if he did, I would check his output, and I would be sure to chart that, as well as his eye and nose. And everything looks good with my patient that way as well. So in summation, my patient looks good in every body system. They don't have any wounds, cuts, abrasions, or tubes and drains. There's nothing like that that I need to assess. But if I did have those on my patient, I would check for eyes and nose and any drains or catheters, and I would be sure to chart that. I would also check any wounds or dressings, and I would treat those accordingly. Okay, so, and then just to make sure my patient feels comfortable, I'm just letting him know that I did shut the door when I came in the room and provided him privacy. And that is very important. So, the end.